Hello, and welcome to the first video for America's opioid crisis, how it happened and what to do now. This 17-part video course is based on my book, Inside America's Opioid Crisis, 12 Hard Lessons for Today's Drug War. Both the book and the video series are designed to explain how the opioid crisis began, how it has evolved, and what should be done now. While overdose deaths have declined from their peak, the crisis is far from over. Addiction continues unabated, the drug supply remains lethal and unpredictable, and millions of Americans are not getting the help they need. Over the years, there's been no shortage of commentary on drug policy. Many have pointed out failures and called for change, or for, quote, ending the war on drugs, unquote. And yes, there have been many failures, which this video series will explore. However, we should not let past mistakes compel us to ignore the problem or to reach for unworkable solutions. We may wish we were done with drugs, but drugs are not done with us. The critical question now is, what can we do to help many more people? This video series will answer that question, not with slogans or sound bites, but with a real plan. But it's not just policies that must change. It's also how we think about people who use drugs, the communities that are impacted, and why our efforts haven't produced better results. That's why the lessons are hard. I hope you'll share these videos, reflect on them, and join me in thinking about how we can move American drug policy towards something far better than today's status quo. Many of the ideas in the video series can be adopted today in local communities. I would encourage you to take action if you can and be part of the solution. If you have ideas or questions, reach out through my website, richardjbaum.com. I'd welcome your feedback and suggestions. Think of this as a 17-lesson course on America's drug crisis. If you complete the videos, you'll be able to request a certificate of completion on my website as a way to mark your progress and your engagement on these important issues. Let me share a bit about my background. After graduating from Georgia University in 1987, I began working on drug policy as a congressional staffer. I was not looking for a position on drug policy, but when I received an offer from the committee called the House Select Narcotics Committee, I was glad to accept it. For a few years, I was out of government doing some research and writing, and in 1997, I joined the Office of National Drug Control Policy, ONDCP. I served continuously over 28 years across 6 presidential administrations, both Democratic and Republican. For 1 year, 2017 to 2018, I was acting director of the agency, also known as the U.S. Drug Czar, and executive director of the President's Opioid Commission. Over those decades, I worked alongside dedicated public servants doing difficult work under intense pressure. I'm proud of much of what we accomplished, but also I saw how government failed to invest sufficiently in the most promising programs at home and abroad. Too many initiatives were stymied by outdated thinking, insufficient funding, or poor implementation. These are not partisan problems, they're American problems, and we all have a stake in solving them. I left government at the end of 2025, and I'm glad to be able to speak openly about the challenges we faced, the mistakes we made, and the hard lessons we learned. The opioid crisis is one of the deadliest public health failures in American history. Too often we fail to anticipate what's coming, to see around the corner, and we've clung to outdated approaches even as the nature of drugs, addiction, and risk have changed. Both public safety and public health strategies need major reform. The opioid crisis is fundamentally different from earlier epidemics. Synthetic drugs dominate the market. Counterfeit prescription drugs look legitimate but can be deadly. Drug products now contain not only opioids, but stimulants like cocaine and methamphetamine and other dangerous substances. This polydrug use can worsen dependence and increase risks. Meanwhile, our response remains fragmented. Treatment capacity is far too limited. Prevention often comes too late. Recovery support is inadequate. The haphazard process of re-entry from prison has become a death sentence for far too many. And enforcement strategies haven't adapted to the need to combat drugs in ways that builds trust within communities rather than undermine it. This video series isn't about blame. It's about responsibility. It's about acknowledging what hasn't worked and building a smarter, more effective response. Here's how the whole series looks. Consider this series in 4 parts. Part 1 illustrates how early choices rooted in fear and misinformation built the conditions that contributed to today's crisis. Part 2 turns to treatment and recovery, focusing on why so few people make it into care and what it would take to build a recovery-friendly America. Part 3 looks at public safety, how we can reduce harm, protect communities, and respond to drug markets without repeating the failures of mass incarceration. It includes a chapter on developing smarter, more impactful international approaches. And Part 4 brings everything together, showing what wise investments look like, how we protect the next generation from this drug crisis, and how the final hard lesson is necessary to help us guide us to carry forward. That's it. I'm confident by the time we work through the final video, you'll have a much deeper sense of how and why the opioid crisis happened and what can be done to address it far more effectively today. The next video turns to the key themes that are addressed throughout this video series and the book it is based on. Thanks very much and see you at the next video.